Hey, it's Alexis. Since everyone's asking, I want to tell you about my new birth control. There are so many options, but like with the pill, what happens when you forget it? And the ones that get inserted? Not for me. Then this birth control patch popped up in my Insta feed, and so I asked my doctor about Twirla. And she said you only change it once a week. You wear it 3 weeks on, 1 week off. I said, that's fire, tell me more. But first, here's some important safety stuff you should know about Twirla. Twirla is a birth control patch for women with a body mass index, or BMI, less than 30 who can become pregnant. Twirla may not be as effective in women with a BMI of 25 or more. Please see boxed warning regarding cardiovascular risks associated with smoking and with having a BMI over 30, as well as other important safety information at the end of this video. So why Twirla? Twirla is the first and only weekly birth control patch that delivers a low dose of estrogen. And I love how Twirla is soft and flexible and designed to stick with you. You can put it here, here, or here. So you can wear it loud or be super discreet. I'm so glad I took the time to ask my doctor about Twirla. Now my birth control fits my life. Do not use Twirla if you smoke cigarettes and are over 35 years old. Smoking increases your risk of serious cardiovascular side effects from combination hormonal contraceptives, CHCs, including death from heart attack, blood clots, or stroke. This risk increases with age and the number of cigarettes you smoke. Do not use Twirla if your body mass index, BMI, is 30 kilograms per meter squared or more. If you do not know what your BMI is, please talk to your healthcare provider. Women with a BMI of 30 kilograms per meter squared or more who use CHCs may have a higher risk for developing side effects like blood clots compared to women with a BMI lower than 30 kilograms per meter squared. Who should not use Twirla? Do not use Twirla if you have or have had blood clots, history of heart attack or stroke, high blood pressure that medicine cannot control, any condition that makes your blood clot more than normal, certain heart valve problems, smoke and are over 35 years old, BMI greater than or equal to 30 kilograms per meter squared. Twirla is also not for women who have diabetes and are over 35 years old, diabetes with high blood pressure, or kidney, eye, nerve, or blood vessel damage, diabetes for longer than 20 years, have had breast cancer or any cancer that is sensitive to female hormones, certain kinds of severe migraine headaches, have liver problems or liver tumors, unexplained bleeding from the vagina, who are or may be pregnant, or take hepatitis C drugs containing ombidisphere, paritaprevir, ritonavir, with or without disabuvir, as this may increase levels of liver enzymes in the blood. Twirla may not be a good choice for you if you have ever had depression, jaundice, yellowing of the skin or eyes, caused by pregnancy, also called cholestasis of pregnancy, or related to previous use of hormonal birth control. What are the most serious side effects of Twirla? Twirla increases the risks of serious side effects, including blood clots, stroke, or heart attack, especially in women who have other risk factors. These can be life-threatening or lead to permanent disability. This increased risk is highest when you first start using hormonal birth control, and when you restart the same or different hormonal birth control after not using it for a month or more. Treatment with Twirla should be stopped at least 4 weeks before and through 2 weeks after major surgery. What are the most common side effects of Twirla? The most common side effects reported by women using Twirla in a study were skin reactions at the patch site, nausea, headache, menstrual cramps, and weight gain. These are not all the possible side effects of Twirla. Call your healthcare provider for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. What else should I know about Twirla? Twirla is a birth control patch for women with a BMI less than 30 kilograms per meter squared who can become pregnant. It contains 2 female hormones, a progestin called levonorgestrel and an estrogen called ethinyl estradiol. Twirla may not be as effective in women with a BMI of 25 kilograms per meter squared or more. If you have a BMI of 30 kilograms per meter squared or more, please talk with your healthcare provider about which method of birth control is right for you. You should not use Twirla any earlier than 4 weeks after having a baby, or if you are breastfeeding. Hormonal birth control methods help to lower the chances of becoming pregnant when taken as directed. They do not protect against HIV infection, AIDS, and other sexually transmitted infections, STIs. The risk information provided here is not complete. To learn more, review the Twirla patient information at twirla.com and talk with your healthcare provider or pharmacist.